My name's Stuart. I'm a resuscitation officer here in Wrexham Minor Hospital, and part of my role is teaching, and sometimes I'm out on the wards clinically as well. Sepsis is an overwhelming infection that affects all organs of the body and is greatly underrated. I think people are missing with the links with sepsis. It affects the body, and even people who have survived sepsis go on to have problems later in life. About 28–30% of people that survive sepsis can still have illnesses, chronic illnesses, for the rest of their life. The reason we don't pick it up quickly sometimes and treat it quickly sometimes is it mimics other diseases as well. So it's not being reacted to as quickly as we would like. So if you leave it too long to treat, then obviously that makes it a worse outcome for the patient. But any infection can become sepsis. So we may be treating one thing while missing others. So we need to look deeper in each case where we suspect sepsis to be taking place. I deliver lectures on sepsis to the nursing staff and to the medical staff. It's been integrated into all our courses now, so from our very small half-day refresher courses right up to our 2- and 3-day advanced courses, we're teaching this Sepsis 6 bundle, we're teaching people how to recognise it using inflammatory responses, and making sure that people pick it up on it, and reminding staff, particularly the nursing staff, that they are a big role to play, in that they can say, I don't think this patient's well, and they can then push that further up the chain to get the doctors involved more quickly, get the advanced intervention team involved more quickly, or worst outcome is when they call in for us to come and see them as a bigger team, taking over their care and transferring them up to the intensive care unit. The Sepsis 6 bundle is a bundle of care that we use when we believe people are septic, and the sooner it's started the better it is for the patient. Some people remember it as 3 in, 3 out, other people remember it using an acronym such as Buffalo, and basically what we have to do is to take blood cultures to find out what infections are growing in the patient. We need to monitor urine output, because unfortunately the kidneys are the first organs to fail when things are going wrong with the body, so kidneys, urine output falling off suggests illness. We need to give them lots of fluids, quite aggressively give fluids. They need antibiotics. We do a blood test called a lactate as well as the blood culture, and then we give them oxygen if they need it, and more often than not they do initially treat with oxygen, fluids and things like that. I think if we're not going to do medical investigations, if you're just a member of the public worrying about sepsis and what to look for when you're worrying about sepsis, things like flu-like symptoms that have lasted for more than 24 hours, urine output, none in 24 hours. If you haven't passed urine for 24 hours, get to a doctor straight away. And generally, if you feel that you're quite sick, then speak to somebody about it, get advice. We're hoping to start ward champions very soon on the wards that will speak to relatives and to our patients to give them advice on what things to look for. Basically, though, what we are asking our staff to do nowadays is, if you think the patient's unwell, if they're scoring what we call the news score, they've shown signs and symptoms, and you worry about them, get help. Get help as soon as you can. For the UK Sepsis Trust, we use their posters to promote sepsis and for people to become aware of sepsis. If any member of the public or any other staff are interested, they're always looking for fundraisers, they're always looking for support, and their website is full of patient stories and lots of useful information. So anybody who goes onto the UK Sepsis Trust website will find the information they need.